Hello and welcome to this session at the Paris Peace Forum on early warning and response systems. We're delighted that you were able to join us. My name is Robin Nataf. I'll be your moderator today from the Paris Peace Forum. I'll be joined by my colleague Gabrielle Butin, who runs our global health policy work, who'll be presenting some findings from research we've been done this year. And then we look forward to a productive conversation with our distinguished speakers today, the Right Honourable Helen Clark, Katharina Boehm from WHO, Mr. Jean-Philippe Dopp, who from the quadripartite One Health organization, Petro Terre Blanche from Afrigen Biologics, James Anderson from IFPMA, Elisabeth Clavry de Saint-Martin from the CIRAD, Marisol Touraine from Unitaid, and Sophonias Tessema from the Africa CDC. And then we'll have reactions from other people in the room as well. So thank you all for joining. So why did we do this work? I mean, in the aftermath of COVID, the Paris Peace Forum was quite active on us supporting ACTA and supporting the global vaccine response. And, you know, we were at a time when there was clearly a failure of the global system to send an alert early, respond early. There was a flurry of initiatives coming from global health actors, looking at how to improve the systems from a technical perspective. And you know, our expertise here, we're not public health actors, we're policy actors, we're governance actors, and we thought it would be interesting to look a bit politically at the lessons learned from COVID, what makes early response systems work, why some people and some alerts were passed quickly, why others were not. And so we did a case study of the detection of the Omicron variant in Botswana and South Africa that involved some field travel that was supported by our partners at Market Access Africa. And then some global consultations with people involved in the global response as well. And so we're delighted to be here today to present very briefly some of the findings and have reactions and discussions around those. So I'll pass the floor to my colleague Gabrielle.
Yeah, thank you, Robin. Just to say that this statement is just introductory and just to give you an idea of why we gathered such a large variety of organizations around the table. And when we talk about early warning and response systems, we may think of only the identify early a threat and then respond adequately. But when we went to South Africa and Botswana to talk to the people that were at the heart of the response, we find way more than just the technical conditions for those systems to work. One of the things we found was the profound distrust from Global South interlocutors that we talked to towards solidarity mechanisms that they considered a failure during the COVID pandemic. And this considered failure means that those interlocutors are now mainly looking for independence when looking at pandemic response. So when we talked about early warning and response, the idea was not we identify a health threat, we pass the word on, and then it's the end. And all interlocutors were very vocal on the need to have the means to respond adequately to the pandemic, and the fact that the variant Omicron was identified in South Africa and Botswana, and then the vaccines were not there, even though those countries was at the with excellent centers of scientific response. So that's one of the main findings. One of the findings is that, of course, mission-driven scientists and scientific institutions are at the heart of the response, and that data sharing networks and informal networks between scientists are crucial to identify earlier threat. And sometimes those scientific networks rely on the goodwill of a few individuals and lack the appropriate formalization and institutionalized scientific cooperation needed. Yeah, maybe another word on independence and building a thriving R&D ecosystem to production health ecosystems. Our interlocutors, scientists, civil society, government officials, were also vocal on the need of fair benefit sharing from scientific data, namely that the scientific data that was used during the COVID response coming from South Africa and Botswana was then used to produce medical countermeasures, vaccines, etc., without a fair contribution that could allow scientific centers of excellence to strengthen, develop, and strengthen their work. So very briefly, a few of the recommendations that we are putting forward in the report that is coming out today is, of course, that the reform of the global health architecture should acknowledge and insert this will from global South actors to respond adequately to the pandemic and to future pandemic, to have the capacity, the means to respond, and also to protect scientific independence from political influence and support the emergence of those scientific centers of excellence in the global South. Finally, the last of the different recommendations that we are putting forward in this report is to explore mechanisms to provide sustainable funding for pandemic response in the global South, and to explore innovative financing models, including fair compensation that I mentioned. So it's only a brief overview, but just to give you an idea of all the subjects that we want to talk about with you during this roundtable. Thank you.
Thank you very much, Gabriel. So first off, let me give the floor to the Right Honourable Helen Clark, who should be with us online. And my question to you, Helen, is, you've been working kind of at the top level of global health and engaging decision makers for better preparedness for a number of years now. How do we maintain and engage political leadership, especially in this task of really rebuilding trust on global health between the North and the South? What, based on your experience at UNDP and before, how would you go about that? What's your advice to people here at the Paris Peace Forum?
Well, my first response is to say that there's an awful lot of trust that has to be rebuilt. Because at a number of points in the course of the current pandemic, low and middle income countries have felt extremely let down by the response of high income countries to different phases of what we've been through. And of course, the most dramatic of those is the vaccine inequity, which remains an issue to this day, with vaccination rates in the low income countries in particular lagging far behind. We simply didn't go into this pandemic with a system for equitable access. And that's something that has to be addressed. Our panel talked about the replacement of the ACT-A COVAX platforms, which were put together, with the best of intentions on the run, but in the end couldn't do the job. We've talked about replacing that with an end-to-end platform, which would also be supportive of regional manufacturing and capacities in the global South to provide for the manufacture of these, what we call countermeasures to fight pandemics in the future. Of course, from the perspective also of the South, the proposal from India and South Africa for the TRIPS waiver at WTO hasn't yielded much from decisions so far. Certainly some clarification of compulsory licensing issues, but not the TRIPS waiver that many had hoped for. And then, as your paper rightly points out, when the South Africans notified the world about Omicron, their reward was to have travel bans imposed not only on them, but indeed of much of Africa as well. So there's a lot to fix here and a lot to rebuild trust around. Now, I think an issue is that currently it's mainly health ministers and their officials that are discussing these issues. And with respect to financing, I guess finance ministers. But these issues do need to be elevated to leader level attention. That's when you get things done. And that's why the independent panel was so strong on the proposal for a Global Health Threats Council at leader level. And I see in the recommendations from the background paper that it's also referring to a similar kind of mechanism. Our panel wasn't the first to suggest such a council at head of state and government level. It came out of the proposal of the Kikwete-led commission appointed by Ban Ki-moon 6-7 years ago. It was endorsed by the G20 high-level panel on financing around pandemics last year, and by others as well. So our proposal would be that the General Assembly should mandate such a council, should have 3 co-chairs, one from the Global South, one from the North, another from G20 to link into where the bulk of the money is. It should report not to the World Health Assembly, it should report to the UN General Assembly, and that's because pandemic preparedness and response clearly involves a lot more than just the health sector. So a hope would be that coming out of the high-level meeting at the UN that's now been agreed to be held before September or by September next year, that a council like this can be a strong recommendation to move forward on. And it's also possible that the political declaration coming from the high-level meeting could reference these issues of equity in access to vaccines, therapeutics, diagnostics, other commodities needed to fight pandemics. There's this discussion to be had on that, and it's not quite clear where the details of that will be had. So I think the resolution could be quite helpful in moving that agenda forward. But to repeat and to conclude, this needs leader-level attention. It's not going to cut it to have it dealt with at the level of health ministers and finance ministers. Heads of government need to be applying their attention to these issues now. Back to you.
Thank you very much, Ms. Clark. We couldn't agree more, and we know how hard it is to keep the attention of the leaders level, in a shifting international environment. Let me right a wrong. I am afraid because she joined us at the last minute, I forgot to introduce Dr. Magda Rebalo, as part of our speakers initially. She's the president of Women in Global Health, and so I will write that by giving you first response, Dr. Rebalo. What are your thoughts on Ms. Clark's suggestions and rebuilding trust more generally?
Thank you so much for giving me the floor. I think former Prime Minister of New Zealand referred to several recommendations made by the panel she co-chaired with the former President of Liberia, one of them being the establishment of the the Council on Global Threats. I think the issue of trust is central to all that we are doing. It is trust within countries, between government and the people. It is also trust across the spectrum of nations, between the Global South and the Global North, and between what's called beneficiaries of international aid, etc. We have several fractures to mend. We have several silos to cross. We have much work to do. It's not possible to do everything at the same time. I think right now there is, rightfully so, agitation around what do we need to do? How do we do it? Who should be around the table? And what are the next steps for us to take? I think at some point there is a need for prioritizing. Are we focusing on the content of what needs to be done and how does it need to be done? And then we look into what shape and form that should take, or like others are doing, starting from the building, from the architecture, and then trying to fill it with the content and then see what needs to be done. I think it should be the other way around. Let's agree on, and there are many discussions around that, but they need to be prioritized. Not everyone is in every room, so we need to bring those pieces together, because important discussions happen in places where other people are not sitting around the table. Someone needs to collate all that, systematize, prioritize, and then we will look into what shape and form should the governance structure take before we can move forward. This is my initial thoughts about this. Thank you.
Thank you very much, Doctor. So start from where we want to go, and then see what institutions will best get us there. Eloise Todd, I know you have to leave us, so you founded the Pandemic Action Network to improve the world's response to the pandemic. What are your thoughts on this question of rebuilding trust?
Thank you, Robin, and thanks for this excellent session. I think both our speakers have just put it excellently well, and the point about rebuilding trust is it won't only be done in the health domain. This is a political issue, to underline what former Prime Minister Helen Clark said, and it's why we need that leadership action. So if we see what's playing out at the COP in terms of climate, if we see the reactions to the fact that the COVID response was really inequitable, the truth is we can't only have leaders around the world on when we're in crisis mode of the pandemic. And to link back to the subject of surveillance and prevention, the prevention piece is really, really important, and it's absolutely crucial that we line up our health systems, line up everything to be ready in case we need to respond. But the whole pandemic continuum includes the desire to prevent pandemics from happening in the first place, and that's why detection of potential spillover is so important, and also the prevention piece to maybe even stop that spillover happening at all. So it feels like that when we talk about pandemic preparedness and response, we need to think of it globally in terms of whole of government approach, whole of society approach, and all of the different political fora, including health fora, but also other leadership fora whereby we can engage leaders on these crucial subjects. Thanks.
Thank you very much, Eloise. So let me, we've had a few speakers here to talk about the need to approach this holistically, break silos. I think that's one of our themes underwriting the Paris Peace Forum, trying to bring diverse actors around the table. And so one silo that is, there are two silos that are fairly prevalent in the global health world I've been learning. One is between early warning and response, and then the other is between animal and human health. And I know that there are a number of actors and initiatives trying to break these different silos. So let me start with you, Marisol Touraine. Do you want to tell us a couple words about your thoughts on breaking the silo between early warning and response?
Yes, thank you very much, Robin. Yes, as a president of UNITED, I would like to say that from our point of view, it's meaningless to address early warnings issues without thinking about the appropriate responses at the same time. Don't misunderstand me. I'm not saying that it's not important to invest on early warning and alert systems, but if you only invest on that, and there is a tendency right now in saying the key objective now is to invest on early warning systems. If you don't think on how the response will be framed and how equitable access to these responses can be guaranteed, then you won't restore any kind of trust between the global north and the global south. And from my point of view, and of course this is based on UNITED experience, equitable access is a key issue. And we have to frame the future of pandemic preparedness and responses with this concept, a very true concept of equitable access. And I really hope that in the future treaty, equitable access will be one of the main key pieces of the architecture. This is a very political assessment and of course with concrete implications. Let me indicate three of them. very quickly, and I'm sorry for oversimplifying my message. First, if we want to create equitable access, we need to address intellectual property and to think about licensing and breaking the bottlenecks which exist, because this is a key issue to access to new products and health products. Second, we need to support early investments to provide simplified models of care. And including test and treat issues, because if you have too complex systems of care, people cannot access them. And third, we won't succeed without a very inclusive governance and implementation directly based on the needs expressed by local governments, communities, civil societies, and women in particular. That's a point which is extremely important for UNITED.
Thank you so much. That, I think, aligns very well with some of the findings from the research that we did. And many of the scientists talked about their limited interest in detecting threats that they then were not equipped to provide any response to, because as medical practitioners, their objective is to save lives first and foremost. Let me turn now to Mr. Dub, who's joining us from Singapore. So, and let me ask you a little bit more about the work that you're doing with One Health to try to also break some of these silos.
Yes, thank you, and thank you for inviting the World Organization for Animal Health to address this important forum on behalf of the quadripartite. You would remember that 2 years ago, there was a launch of OLEP, the One Health high-level expert panel, in occasion of the Paris Peace Forum 2020. It was an initiative from France and Germany in the framework of the Alliance for Multilateralism. And the 4 organizations, international organizations dealing with this topic, WHO, FAO, UNEP, and the World Organization for Animal Health, selected a panel of 26 experts which represent the different regions, the different thematics, different topics, to better address One Health. Someone was talking about inclusivity. Inclusivity is also true for science and for building trust. So the first step was to build this scientific panel, which is at work. They already produced an holistic definition of One Health. They are working on a surveillance framework. We asked them to define what is the concept of prevention, in particular deep prevention. And then we moved to the second step, which was at our level, to draft what we call a One Health joint plan of action. I like to hear that we should go step by step. We should prioritize. So the first step for us was to launch the One Health high-level expert panel, which is a reality today. We are with them in Singapore to discuss very important topics related to One Health. Second step was the launch of the One Health joint plan of action. It was done recently in Berlin in occasion of the World Health Summit. And the next step will be to develop an implementation framework, because all of this happens at country level. One Health should not stay as a theoretical principle, a nice principle. It should be implemented in the field by our members, by our countries. And for this, we need guidance, we will need support from global leaders. It was said by a former Prime Minister from New Zealand. And we will need also some financial support. This will be in particular the task of the new 5th Financial and Intermediary Fund, which will be launched within 2 days in the framework of the G20, chaired this year by Indonesia. Over to you.
Thank you so much, Mr. Dup. Let me turn now to Elisabeth Clavry de Saint-Martin, who's here as the CEO of the CIRAD, and who is specifically represented one of the projects we selected this year at the Paris Peace Forum, which is preventing zoonotic disease emergence. Présode, over to you.
Thank you very much. Before starting, I will invite you to come and see our stand, which is just around the corner. We'll be more than happy to explain you deeper what we do. So I speak on behalf of the three organizations. We've been doing it on a trilateral basis with INRAE, Jean-François Souzenaille is over there, and with IRD, and Corinne Brunon-Meunier is representing. So we had this idea because we work every day together. We saw that there was really a need, and I want to insist on the need because it has been really touched upon by previous speaker. And just to tell you, because institution has been really present in all the speeches of previous speaker, how we decided and what we proposed. So. The first thing we've noticed is that many things have been done before. And that is good for scientists because they're not always so humble. So we noticed that there had been many initiatives, for instance, around avian flu, around Ebola, around swine fever, and that we should take stock of all these initiatives. So Présode is first an initiative. We recognize the work which has already done and which includes and takes stocks of this work. The second point is that we decided, when it comes to One Health, to do it differently. So if I say do it differently, I would say 3 points. One, we decided to put co-construction first. And this has been already emphasized on. So co-construction, it's, when you look at Présode, it's more than 150 participants. It's more than 15 countries involved, and all the project, it took us more than 1 year to build the project because we built it with all these partners, mainly coming from Global South. So we made it differently. Then we put on equal footing prevention, science, and advice to decision making. And this is important because prevention, it is important, we've said it, but science, there are still lots of things to work on and to discover when we come to pandemics and One Health, so we do not have to forget it. And finally, advice to decision making, we've seen that's a clue, just to raise the signal on time. The third point, and it has already touched upon mainly by Madame Touraine, putting differently by seeking solidarity from the beginning. What it means, seeking solidarity, is at the same time we've built scientifically the project, we've been looking for financing for the poor countries, asking to French Agency for Development, asking for European Union, and we still devote lots of our time seeking this financing so that it's an inclusive initiative. And the third point and last point I would like to say is that what we did really is that we wanted to, with this initiative, to make One Health happen at a larger scale. It has been said by our colleague from OEO, things happen at the local level. They happen in countries, and pandemics start in a place. So we wanted to keep this local focus, but at the same time to make all the networks converge so that it can rapidly and efficiently come to a larger scale and be useful. Thank you.
Thank you so much. So I think from the last three speakers, we got a few ingredients, right, of what it could be like to break silos, the idea of being a white tent, co-constructing, the idea of learning from those at the forefront, connecting the local to the global. So this was really helpful. Let me switch gears a little bit and turn to you, Katharina Bohm, and you're representing, of course, WHO today, but also another project that was selected, which is linked to your new Berlin hub, which is called Epidemic Intelligence in Open Source. And my question to you is simple. It's basically how to make sure that political action and decision-making at the global level is better guided by science. We see in the report, and I'm sure you all see in your work, this, challenge in communicating scientific findings and making sure that decisions are made based on sound science. So I'm curious to hear what you have to say about this.
Yeah, thank you so much. I think your case study is really a stark reminder of the lessons learned from COVID on equitable access and trust. But it also reaffirms that I think together here with all our partners at the table, we are on the right track when we work on strengthening the global health architecture. And so I'd like to look at this as the glass is half full, because never before have we seen so many innovative approaches to partnership that have helped us generate vaccines in a record time, medicines in a record time. Never before have we seen such convincing and I'm sure successful efforts in bringing and advancing local production in Africa and Asia, mRNA vaccine production hubs, diagnostic hubs, etc. So I feel we've learned as a community so much. And so yes, we need better governance, we need leadership, we need financing solutions, and we need to work on systems and tools together. But wherever I look, I think we have seen very concrete progress over the last 1 year. And so while the geopolitical context is difficult, let's not give up on that. To your concrete point on science, maybe before getting there, for me, I see as the umbrella solution really the pandemic accord, the pandemic treaty, and I won't leave this room without emphasizing that, because I do see, yes, a threats council can help, but unless we have an overarching framework against which we can all hold ourselves accountable to, whether we are from industry, whether we are from governments, whether we are from civil society, I think that's what we needed. And it's not that the Global Health Security Council has frankly done a lot for us in this pandemic. I think after 18 months they came up with the first resolution on COVID. I think we can, these gremia and leaders can only help if they're being held accountable against something. Now, on science specifically, I think the power of science and scientists and informal science networks is a key part to build upon. When you look at the COVID pandemic, the first PCR test for COVID was developed within a week by scientists after the genome was shared. When you look at all the exchanges of various mutations, the genomic sequencing sharing, that has all been possible through scientists that preserve, even in a world where we see a lot of animosities, preserve their friendships and preserve their human relationships for sharing. So I think building on science and innovation going forward is absolutely key. Now, here, one of the flagships, as you say, Robin, for WHO is the project or the initiative led by our WHO pandemic hub in Berlin, is an initiative on epidemic intelligence from open sources, and it very much builds from what we've learned in this pandemic about the importance of transparency, data sharing. It builds on what we've learned about collaboration, and we live in a fragmented, complex world, and I don't think we will be able to simplify our world. So I think instead, we have to learn to work with the complexity and the fragmentation and build new cooperation models that take that into account. And so I'm really proud to have this flagship project here, which does that on surveillance, on collaborative intelligence, and really tries to create a new model in terms of how we can work together. Thank you very much.
Thank you very much, Dr. Boehm, and we're also delighted to have this initiative here, and we really hope that it grows and develops. Let me turn now to
Can I just say one last sentence? Please. I couldn't leave this room also without saying that our One Health partnerships, going forward as WHO will be so key, and I see many of our partners here at the table working on One Health, and really I think given that 70% of new threats come from zoonoses, I think that will be absolutely key, and we have to bring this from leadership against and voicing it to actually doing and working together. Thank you.
Thanks so much. So Dr. Tessema, you work on the Africa Pathogen Genomics Initiative, which is another way to bring scientists together and to bring science to bear on better early warning, better prevention. Can you tell us a little bit about this and about your thoughts on the recommendations of the report?
Yeah, thank you very much for this opportunity. I think from the Africa CDC, Africa Pathogen Genomics Initiative, this initiative was launched before the COVID-19 pandemic with the idea of strengthening detection, prevention, as well as response. So I think as it was said earlier, these three things cannot be separate. We need to prevent, detect, and also respond. But our prevention, detection, and response must be based on good science, good quality data, and it must be locally aware, regionally aware, as well as globally coordinated. So at the Africa Pathogen Genomics Initiative, what we are trying to do is trying to bring national public health institutions at the forefront of prevention, detection, and response, empowering national public health institutes, institutes that have the political mandate to use data, to share data, and then also to respond to outbreaks are at the forefront of our initiative. What we are doing is we are empowering those institutions with the necessary laboratory equipments, laboratory supplies, workforce development, so that these institutions can deliver on their mandate as much in early possible timeline, so that there is no delay in the detection and response to disease outbreaks. The other unique part of our initiative is it's also built on partnerships, partnerships that brings the private sector, the public sector, the philanthropic sectors together with government institutions, so that the challenge that we are having, the challenge that we are discussing, it cannot be addressed by one partner or one stakeholder. Rather, we are trying to bring different stakeholders, different opinions, different perspectives in our capacity building effort in response to this COVID-19 pandemic and beyond. The other area that you also highlighted earlier is the community building. How do we build a community? So the Africa Pathogen Genomics Initiative of the Africa CDC is building a community. We are bringing together not only at a higher level, but at a very lower level in the lab, those technical people, the younger people, they are coming together. The data scientists, they are coming together, sharing resources, sharing expertise, so that we can build a bottom-up approach. If we can bring together the technical staffs, they can bring their institutions together. If institutions come together, organizations can come together, and countries can come together. So our approach is mostly a bottom-up approach in building community. And this is really paying off. We've seen a strong collaboration that we have built in the past 2 years across the continent that is enabling data and resource sharing. Thank you. Over to you.
Thank you so much, and we're so glad that the Africa CDC could be represented here today with you because of this, really important work that you're doing at the forefront of our health security. So thanks for that. Okay, let me turn to a last question that I'll ask a couple speakers, and then maybe I'll open up for a few questions from the audience. So a last finding, and something that's been highlighted by a number of speakers, is the question of ensuring compensation for scientific discovery. A lot of the scientists that we met, talked about the risks of infringing intellectual property in some of their work, but B, the fact that a lot of their discoveries did not result in better resources, better ability to ensure health security, better ability and resources to respond in their contexts. And they were calling for, what they called fair benefit sharing, and the report explores a number of ways we could think about this. So I'll start with Dr. Terblanche, who's calling us from South Africa, and ask about your thoughts on this. Please, Doctor.
Robin, thank you very much and good afternoon to everybody. I'm actually calling from South Korea and proudly South African. Thank you for the opportunity to participate in this important forum. Benefit sharing for data and discoveries which are not patented and which are maybe perceived not to have value, I think is a critical, important model to be developed. I think what will be important is to look at some of the case studies that sits in history, and in preparing for this, it took me back to 20 years of memory when South Africa firstly signed benefit sharing agreements with the holders of indigenous knowledge owners. So indigenous knowledge also not recognized as intellectual property. Indigenous knowledge in the minds of people and years of experimentation using natural products and coming to solutions and using that. That indigenous knowledge provided the input and the basis for innovation, product-based innovation, where the value is created. And South Africa in early 2000 signed, or actually at the end of 1999, signed a benefit sharing agreement with the San people, recognizing indigenous knowledge. And this situation, this exact year, the discovery of an Omicron variant took me back to that time.
We can hear you perfectly.
Can you? My system just changed. It took me back to that time, and I do think we could look at those models. What is important that it must be fair and it must be transparent. These are not simple models to develop, but I do believe there's merit and rewarding these scientists who does not ask for reward. Scientists are happy to be recognized and to make a difference, but we also need to ensure that the value is not only realized in the private sector, but also in the hearts and the minds and the pockets of our scientists. So I would strongly support developing a model for recognizing and benefiting scientists making these important discoveries.
Thank you so much, and it must be very late in South Korea, so thank you for being with us so late. Our last kind of planned speaker, and then we'll open up the discussion a bit, is James Anderson, who leads the global health work for IFPMA. And so from the perspective of the industry, can you share a bit more about your thoughts on this idea of fair benefit sharing?
Sure. Thanks very much. Really pleased to be part of this fascinating discussion as well. I wanted to start at a higher level because I think what's clear is that there is a good level of alignment on the really important parts of this discussion. So collaboration and trust-based collaboration are absolutely critical going forwards, and we need to work to address that. Secondly, we can do better next time. As the pharmaceutical industry, we're committed to playing a fundamental role in future pandemics and a part of the preparedness, and we believe we can do better, both in terms of the speed of response, which, as has been said, was unprecedented this time around, and frankly is probably why we're all able to be here today. That shouldn't be forgotten. But we've fully committed to the 100-day mission, which will mean that in future we should be even faster to respond. And the access piece as well. We absolutely recognize that we all need to work together to do better on that one as well. And then thirdly, I think what Katerina and others have said about being led by the science is very much a shared belief. But I would add to that, and it was said on the previous panel I listened to, that we mustn't let politics trump the science. We did see that during COVID. We still see it now. We certainly see it in a number of the global debates, whether it's on the treaty, whether it's on IP, and so on. So when it comes to surveillance specifically, for me, the global system of surveillance is as strong as its weakest link, which means we need to think about it in a global way. When the first COVID-19 sequence data was published on January the 10th, 2020, that triggered a massive mobilization of researchers around the world. Everyone had access to that at the same time. It could have been even quicker. It could have been published even quicker, right? There was a delay. We shouldn't lose that, but it was quite quick. So speed is of the essence, and openness. equal ability for all researchers in the north, in the south, in academia, in big companies, small companies. That's what led to this rapid success. Over 300 vaccines candidates were started, 9 have been approved, and 10 as of yesterday, I believe. You know, this was unprecedented, the collaboration between private sector and public sector, between competitors, between big companies, small companies. If surveillance systems in the future get changed so they are bogged down in bureaucracy or in nationalism or in restrictions or heavy negotiations, that delays that timeline. We need to be crystal clear on that, and that is frankly one of my concerns, that it can easily come into this discussion. So our priorities, that's number one, to make sure it doesn't. Secondly, I briefly want to talk about access, because I do think that's this other part of the same side, the other side of the same coin. So on access, the industry recognizes that we have an important role to play to do better next time. We've recently launched the Berlin Declaration.
Sorry to interrupt you, but we're hearing a jingle. I don't know why. Oh, it's the next stage. I'm sorry.
The industry came together, our member companies, to launch the Berlin Declaration, which commits in future pandemics to reserving an allocation of real-time production for the priority populations in lower-income countries. That wasn't in place this time around. The WHO identified very early on the priority populations, and yet still today, in many countries, they are not all vaccinated. That's failure. And our commitment is to hold that allocation. We need partners to work with us to take those vaccines and distribute them correctly to those priority populations. We need the countries where we manufacture to allow us to export the vaccines to those priority countries. And we need the global system to make sure that those countries are ready and equipped to deliver the vaccines in mass quantities. Thank you.
Thank you so much. So you know, highlighting the importance of speed, the need to make sure we keep that speed if we're thinking about new mechanisms for fair benefit sharing, and this call for equity, which is again welcome, and it's great to hear consensus around this. I'll have a last couple of questions, very brief, and then I'll turn to the audience. But first off, Mathilde Bournou from the Gates Foundation, you supported this research and this work that we've been doing over the past year. I'd just like to hear, you know, why did you think it was important, and what are your thoughts on the conversation we've just had?
Thank you, Robin, and thanks so much for inviting me. I'm here to represent my colleague. We're actually working on this report, and we couldn't join today. So thanks so much for inviting me today. Well, I think we had this word about rebuilding trust, equitable access, and as actually Eloise Todd said, it's a political question, but it's also a question of collaboration. So over like the 2 last years, the foundation incredibly focused on the COVID-19, as many organizations. But after these 2 years and a half, we kind of wanted to step back. And that's where we came with the Paris Peace Forum, which is a kind of trust partners, as you know, and we really work excellently with the team. So we decided to conduct the study to actually identify gaps, challenge, to also find a way to better collaborate with the global north and the global south, which is the DNA of the Paris Peace Forum as well. That's where the idea came a year ago, actually just 1 year ago. And we closely work with Robin and Gabrielle to identify the methodology, the countries as well, and really representing my colleague Scott, in particular in Brad, working on pandemic preparedness for 2 years. That helped working on this study. And maybe just a few last words on the importance for the foundation. So integrated disease surveillance is one of the priorities for the foundations, along with strengthening the pandemic workforce. That's really related to your speech, Sophonio, on reinforcing community. So that's the key pillars for the foundation in the work we are doing on a day-to-day. And thanks again for inviting me.
Thanks, Mathilde, and thank you for your support. Are there any questions now from the audience? Yes, please. Can you introduce yourself very briefly?
I know you talked about response, and I couldn't agree more. We know that the pandemic in places, even in the global north, like the United States, increasing conflict dynamics made it difficult to near impossible to prevent and contain the virus. We got lucky with the vaccines. But we also know that COVID increased conflict dynamics. And I'm going to in the United States, in the global north. So how do we make sure that conflict and peace building is baked into the response? WHO says it perfectly, Dr. Tedros, health, peace, peace, health.
Would you like to take that? We haven't heard from you yet. Yeah, Dr. Udayakumar.
Sure, thank you. I think it's a really important question. And I think there is, where we started, really around trust building, right? We can try to separate the science from the politics, but I would argue exactly for the opposite, that science is political, public health is political, and we have to actually embrace it as opposed to try to separate it. And if we don't operate in the political arena, we will lose every time. And so understanding more around science communications, who are the right messengers? Oftentimes our public health officials are not the right messengers, especially to reach the types of populations that we need to reach. So to me, there's sort of this interconnection between trust, governance, and this idea of equitable access. So the ability to make sure that we're reacting in real time, that we're using the best messengers that we have for various communities, recognizing that we're living in a more fragmented world, not more cohesive world as we go, and that the science is the science, but the way it's communicated and the way it's applied has to be nuanced at the subnational level, I think, for us to be effective. One other point I'll just add to this conversation, we've talked a lot about this national perspective, countries acting, and about the global architecture. I really believe that going forward, we need to strengthen the middle layer, the regional approach. I think one of the bright spots of this pandemic response has really been the leadership of the Africa CDC across the continent in partnership with the African Union. We're in many conversations in other regions, including Latin America, where there has been a lot of trust lost, not just with the global north, but with our multilateral institutions. And I don't think we're going to be able to pull back in any appreciable time from this movement toward regionalization. And it's in our best interest to understand how do we actually strengthen regional responses as a mechanism to rebuild trust and capacity.
Thank you so much, Dr. Udayakumar from Duke University. And I will take that opportunity to make a plug. We have a panel just after this at 2:30 upstairs on regionalization with the French, Senegalese, and Rwandan Ministers of Foreign Affairs who are going to be talking about that. Any other questions from the audience? Probably a last one. Oh, Dr. Terblanche, sorry, did you want to come in here? We can't hear you.
The one is around pandemic prevention, and I'm referring to the One Health and Zoonotic Diseases Initiative, which I think is fantastic and a great initiative to pull that together. But we must not forget about communities, because evidence-based and cause-effect relationships to be understood by communities is part of a communication and an education process, and that is a critical component of our debate that's not maybe not properly covered. It's communities. The other comment that I want to make is the comment on regionalization and regional access and regional capacity building. If we analyze the gaps in the pandemic very, very carefully, we'll find that there's a significant component where health systems failure was a result of poor vaccination. Even at a time when we had sufficient vaccines, there was health system failure. And there are many factors there. there. Unless we build regional or local capacity for end-to-end also manufacturing, we will also not build the health systems that will support that. So we can't look at this singularly. We have to look at it in a systems approach. And then last comment, we talk about trust and we talk about collaboration, but we must also talk about respect. The respect for the scientists in low and middle income countries on the African continent, building and knowing and coming together is a requirement for us to also to recognize that low and middle income countries can contribute not only to pandemic preparedness, pandemic prevention, but also to access. Thank you.
Thank you so much. So respect, trust, thinking politically, we're getting some pretty good ingredients here for a more conflict-sensitive approach to health. Is there a last question from the audience? Yes, please. Very briefly, we have 2 minutes left.
Thank you. Speaking of early warning, my question would be, how do we believe Cassandra? You know, for the myth of early warning and the science being there, but it's always dismissed. We always react too late. And so my question would be, you know, we're talking about application, trust different local actors, but that's about application. How do we get people to take the early warnings seriously right away instead of being dismissed? Because you mentioned, all of you, different hours, different times. So.
Thank you very much. Clear, and that question applies not just to global health, I think. I'll let Thierry Lefrançois have the last word here from CIRAD.
Yeah, if I may answer by several keywords. Partnership, okay, anticipation, reaction, initiative, and science, that is Paris. Prevention, epidemic intelligence, activities, communities, and emerging disease, that is peace. And financing, One Health, regional, universal, and medicine, that is Forum. So I think trust is a result of that.
Thanks. That was a dense answer. Do you want to give it a shot?
Yeah, thank you. Very briefly. In addition, we need to address the underlying causes, and we know that biodiversity
Thank you very much. I think this concludes our discussion. Thank you so much to all our speakers. Thank you all for following. Thank you to the people joining us remotely from across the world at crazy hours. Please read the report that's coming out today. Give us your comments and thoughts, and we look forward to continuing the conversation. Thanks very much.